On to Coffee Talk. Today's topic is, why do you see that white halo around your eyebrow? I'm going to show you a picture of it now. It's just the one here. When the work is freshly done. And here's the reason why. So firstly, I'm going to talk about the medication that we use on your eyebrows to control any discomfort that clients have. And it's one of the things that people ask us when they make a phone call: is it very sore? And the reason that they've heard that it's very sore is because they've had it done someplace whereby they don't have the level of medication pain relief that I do here as a qualified nurse. So I can't retail it, sadly, because I'm not a pharmacist, but I can use it. And anybody who comes here gets a cream, an anesthetic gel and an anesthetic liquid. And when I ask them afterwards, what do they feel from a pain point of view? Without exception, it's usually 1 or 2 out of 10. 10 being labour pain, the worst pain that you could possibly have. And they're very tense at the start because they're just so afraid that actually they're going to be very sore. In fact, one of the clients yesterday said, for God's sake, like it was nothing. While we are doing the consultation part of your work, we have a cream on, and some people actually arrive an hour early, and we allow you to pop on the cream an hour early, even though sometimes it's very unnecessary. But you know, if you have the fear factor and it gives you any level of comfort, why not? So there's the cream, the gel, the liquid. So when I actually make the outline strokes, of which there's about 15 in total, the most you'll feel will be a 3 out of 10, which is actually a bit like threading or plucking is far sorer. But when I make those outline strokes, then I get the next anesthetic in, which is the gel and the liquid anesthetics, and they work on broken skin. So they actually work in under the skin, exactly bang on where the nerves are. So included in one of those topical anesthetics that we give you is a drug called epinephrine. So what the epinephrine does, it's not a pain relieving medication, but what it does is that it causes vasoconstriction. So that basically means that if there's going to be any bleeding associated at tattoo time, and remember this is an unregulated industry, that it constricts the blood vessel, therefore it keeps any bleeding to a minimum. But as a result of that, what it does is that it actually closes down the blood vessels, and it causes that white halo all around the work as it's being done. It's a bit like if you used to ever get white fingers in the cold. That's called Raynaud syndrome. Or if you are one of these people that, you know, if you get a nettle sting, for example, so let's use my face here. So the sting is here, but there'll be a white halo around it. And that's the vasoconstriction of the blood vessel. It lasts all of 20 minutes. And obviously that halo is still around the eyebrow when I'm taking the photographs, because we take the photographs straight out of the work, do the tidy up, and then the client leaves. And by the time they're probably down at the bottom of the stairs, that halo has actually dissipated. So the amount of people actually who have reached out and said, what's that white halo around the eyebrow, and is that going to be there forever? No, 20 minutes is how long the drug lasts for. And it actually dissipates in 20 minutes as soon as you leave. In fact, that white halo has actually dissipated. So it's a very prudent question, and when you're doing your research, a lot of people actually, it's one of the things that you know, that they could actually comment on, because they're looking at the brow shape, they're looking at the brow colour, they're looking at all the other brow things. It's all part of their research. And when they notice that there's a white halo around the eyebrow, it's very important that they are reassured that it's actually nothing to worry about. It does dissipate, but it also helps to minimise any bruising. So it's a real win. It's an absolute win-win, and it's only as a medical personnel, as of which I am, that we have access to this drug. So, yeah, so that makes the results really lovely as well, because when it keeps the bleeding to an absolute minimum, what it does is that it actually optimizes retention. So it works very well in the sense that if you had very sensitive skin, or you were on aspirin, for example, low dose aspirin, we can still do you. Any of the other anticoagulants, and I'll talk about that another day, we can't do you. Warfarin or heparin, no, you're not good candidates. But for anybody who has a you know, an increased blood flow when we do the work, it actually washes the pigment out, and we're trying our best to get it back in, because that's where we want it to be. We want it to be in your skin to create the tattoo effect. So yeah, this keeps it all to a minimum. Happy days.